Good afternoon, everyone. Thank you for joining us for our Computex Cities Lunch and Learn. Today's topic is security risk assessment. I have invited some of our specialists here, Marianne, John S., and Neno, to tell us more about it. Today, for first time, we are using a new tool. So let me introduce you to that. I believe your screen looks very similar to what you see right now. On the top right corner, you have a first tab on the top. You can click on it, and it has some informative PDFs that you can download along with the PowerPoint for this presentation. And on the bottom left, there are a Q&A that you can ask the question throughout this webinar, and at the end of a webinar, we will answer all of them one by one. So today's presentation is security risk assessment. Are you in violation? Why we picked this topic, security risk assessment, SRA, is for many webinars that we have attended in the last 3-4 years, and that covers a lot of technical and the laws and everything, but still we are all not familiar with every single detail of it, what it is, why it is, and how it's done. And in 2014, many of our clients had misunderstanding, or they were misled by other vendors on SRA, so we wanted to have this webinar to clarify some of the things. And in 2015, first quarter, we were contacted by many people when it was too late for us to help them. So we decided to do this webinar earlier this year to help you understand what is SRA, why it's done, and how to do it. Along with all the questions that we were asked, there are many myths that we have come across, which a lot of our clients think that I have a cloud-based EMR, so I don't need to worry about it. Why can't I do the SRA remotely? Why my EMR vendor take care of everything because it's a certified EMR. And this is a good one. My security risk assessment was done last year, so why do I need it again? I have my lawyer do it, so I don't need IT help. And the last one that we have heard is my IT person is doing all-inclusive service, so they also include my SRA in it. So these are all the myths that we have heard, and like I said earlier, I have invited some of our specialists to help us understand the risk assessment, what it is, how it's done, and why we have to do it. So to introduce Marianne, who is our meaningful use specialist, so she's going to talk about how the SRA is part of meaningful use.
Thank you, Soren. So I will be talking to you all about SRA and how it's related to meaningful use with the 2 stages, 1 and 2, and what differentiates the 2 stages in terms of the SRA. Documentation requirement for the security risk assessment, and the audit process of meaningful use, which includes security assessment audit, and then what types of audits you can get from CMS. So just to introduce security risk assessment and meaningful use, I'm sure you've all read about this many times, but going back to 2009, the HITECH provisions of the American Recovery and Reinvestment Act in 2009 established the CMS EHR incentive programs. And then they introduced the concept of meaningful use. It started in 2011 with it ending in 2016. And that was the introduction of certified EHR technology. There's identified two types of eligible providers. You could either be a provider working in an office or an eligible hospital. They term it EP and EH. So the adoption of meaningful use in 2011 had 10 objectives as highlighted. And I'm sure you've all seen that the first 9 objectives are, dealing with patient involvement, patient care, and improving quality of care. But the last point or objective has to do with maintaining privacy and security of patient health information, or PHI. And this is going to be our focus today. So just to give you the definition of SRA, and aside from attesting to your core measures, which you all know, the 15, and then the 5 menu sets, total 20, clinical quality measures, which you have to report on as well, you have to do a security risk assessment. And then to receive the incentive payment, you must also demonstrate that you have met the criteria for the program's privacy and security objective, which is the security risk assessment. And it states that you have to conduct or review a security risk assessment of the certified EHR technology and correct identified security deficiencies and provide security updates as part of an ongoing risk management. This used to be the definition of the SRA objective in stage 1. Now in stage 2, there is a very subtle but very important change that was, or addition that was updated, which is including and addressing the encryption/security of data. And again, CMS, by putting in encryption/security, they're kind of making it very important to analyze the pros and cons of using an EHR. So now you don't only have to use it to improve quality of care, but you have to keep in mind all the security safeguards and the things that might be compromised as a result. So this was added, and it's highly recommended that you read between the lines, or between a slash, I would say. Encryption has a lot to do with security, and you have to make sure your patient data is not compromised now with the introduction of the patient portal and health information exchange, or HIE. So one of the main questions we were asked in 2014 was how or when do I test for a security risk assessment? A lot of our clients were either finding out too late or not having a plan of action at the beginning of the year. So I put a frequently asked question from cms.gov, and this is a very, very trusted source whenever you have any questions about meaningful use or security risk assessment. And the question states, how can a provider meet the protected health information core objective in the EHR incentive program? And the question we were asked was, what's my timeline? When do I have to do a security risk assessment? So the answer from cms.gov is these steps may be completed outside the EHR reporting period time frame, but it has to be no earlier than the start of the EHR, obviously, because you want to make sure that during the time you reported your numbers that you had a security analysis done and your patient data was secure. And no later than the reporting provider attestation date. So whatever reporting period you're doing, whether 90 or a year, you would have to make sure that it's done before you submit your attestation. I recommend you just do it within the reporting period, just to be on the safe side. But if you were not to have it done during that 90-day period or 1 year, it's always recommended you do it before you submit your attestation. And there is an example here for you. Again, this is straight from CMS. If eligible provider reporting meaningful use for a 90-day period, you may complete the appropriate SRA requirements outside this 90-day period as long as it's completed no earlier than January 1st, let's say 2014, and then no later than the day the provider submits their attestation. For example, for 2014, the deadline was March 20th. So you cannot do it anytime later than that. So going on, now you know when to submit or do your risk assessment. Now, what types of documentations do you need? And this is very important to make sure your entire process is as seamless as possible. So we always recommend you take as many screenshots as you need. And your vendor should give you recommendations on how to do it within your software. Each vendor has a document on how you can prepare your documentation for meaningful use and security risk assessment. So save as many screenshots. Make sure that all screenshots have the date within your reporting period. So don't save a screenshot from 2013 for your 2014 reporting period or 2015. And then your documentation has to support every single piece of information you provided on CMS during attestation. So all of the denominators, numerators have to be captured straight from your EHR. So, and for the SRA, you would have to document that you had done it. And then if there is any remediation plan that was put in place, you have to make sure you have it on file, visually in a digital format or a paper format. And the main key is just to make sure you save every piece of information you have, so that when you are about to attest, you are assured that if you are selected for an audit, you will be good to go and have your information ready. And I'll talk about the audit process next.
So to add to that, as you guys can see, it says you have to save all these records for 6 years. So Marianne said either keep it digitally and make sure it's back up somewhere, or have a printout and create a folder just for meaningful use. And every year that all the proof and documentation you have, keep on adding it to it. But don't just keep it in the email that accidentally can get archived or deleted. So make sure it's saved properly somewhere, because you may need it within the next 6 years.
Exactly. So now going on to what the audit process looks like. And again, everything we're discussing today is from what we've come across from our own clients. So you know CMS plans to audit 10% of all of the attestations. So you have a high likelihood of being audited. Always keep that in mind, although it's only 10%. The initial phase is they send you letters. They send provider letters in the format of an email. So you'll get an email from the CPA that's assigned to do the audit, and they will introduce what it is and then what type it is in the subject of the email, and all of the requirements they need from you and how to submit it to them or upload it to them. The CPA firm is called Figliozzi & Company. It's an accounting firm. So always keep that in mind. They're going to be very, very strict on what they need. If they request a documentation from you, it's exactly as written. So you would have to submit as they request. And then I've never seen this, but I do know that on-site reviewers may be, following the audit if your documentation is not sufficient. So always make sure whatever you submit in the first phase has everything they need. Otherwise, you'll have someone knocking on your door and asking you to demonstrate everything in your EHR system. Any questions you would have about the audit, you would point it to the CPA, a person that's emailing you, and they will give you the contact name that's assigned to you and their email information. Once they review everything, they will let you know if you are eligible or not. If you are ineligible, they will recoup their money and be on the lookout that they will audit you again in the future if you fail it. So if you were to submit next year, you have a higher likelihood of being audited as well. Now, what types of audits do you or might you get? Those are actually real examples, although you can just Google, what are the different types of audits you may get from CMS. These are the two we came across, limited audit, and I'll talk about prepayment audit next. The limited audit, it will ask you to submit proof that you have an EHR system, because you just submitted all this data. They want to make sure you actually have a certified EHR system. So they will ask you for the agreement that you have purchased an EHR system and the certification ID of that EHR, saying it is a certified meaningful use software. And again, in the email body, if you guys can see it, they will give you the email address to where you email things back as an attachment. This one, for example, is saying attach it back and just put your NPI in the subject. Another one may ask you to log on to Figliozzi & Company and upload it, or upload it to a third-party company. So that's what the limited audit is, and it's actually the easiest one because you just have to prove you have an EHR system. Now it gets funner and harder. There's something called prepayment audit. So let's say you submitted for 2014 last 90-day period or last quarter. You get a prepayment audit saying you will not get your money or incentive unless you prove to us that you have documentation of all your core measures, menu sets, clinical quality measure, and security risk assessment. In that case, you have to submit everything you've documented, and that's why I always highlight to keep and save everything. So basically, once you finish your attestation, save it in a folder, because the response to this email would be, here's the folder with all my documentation in it, with all the dates included. For the security risk assessment, make sure you have whatever was done in your remediation plan and have the date on it when it was conducted. Do not send that piece of information without a date, because they will send it back to you saying it failed. And again, they give you a chance to put the date back on the security risk assessment. They don't just tell you, we're going to take our money back. They really try to help you. So make sure you have everything ready and done before you submit anything to them. The next section of our webinar, John here, our project manager and SRA specialist, will be talking to you about what your practice needs to make sure that you have your security risk assessment done and in place at the right time.
Thank you, Marianne. So first we're going to talk about what exactly does my practice need. If you do any research for security risk assessments, you'll see two common terms, compliance assessment and risk analysis. The difference is they're very similar, but they have a lot of differences. So think of a compliance assessment as an overview of your security and whether or not you're meeting HIPAA standards. It establishes a baseline to measure your practice's performance. So it's kind of like a bird's eye view when you see everything but not in great detail. A risk analysis is the opposite. It's more in-depth. It takes the question, are we meeting HIPAA standards, and gives detail on exactly why or why not. It's a worm's eye view, so you see everything and every little detail of exactly what's going on in your practice. Just know that a risk analysis is required in the HIPAA security rule, and it's the foundation of a risk management plan. So whoever you decide on performing your risk analysis, you must have a BAA signed with that company, and that makes sure that that company is secure and that you are as well. So there's some common misunderstandings with your SRA and what Soren had talked about earlier, and I'm going to kind of review some of those right now and go into more in depth with those. So the first one is, can this be done remotely? Really, you must have someone on site at your office. There's many different facets of a security risk assessment that someone must be on site for. I'm going to mention some examples, but make a mental note of your practice's procedures for the following questions. Can you see computer screens from a patient's perspective? If you can, you should use privacy screens or have monitors face away from patients. Are there old computers sitting in your office in unused rooms or in the back office? If they still have a hard drive in them, they could potentially have ePHI still, and it become a liability. Same thing with portable hard drives or thumb drives. Are they used for patient information? If they are, they need to be encrypted. They could have PHI on it, and most likely are not encrypted if they're used for office staff. Like shown in the picture on the slide, passwords written on a sticky note. That's a big no-no, but practices still do it because people can't remember their password, or they have passwords for multiple different things. It just shouldn't be done. An auditor can also look through trash cans for non-shredded documentation with PHI on it. Does your staff just throw away documents that might have PHI on it? Everything must be shredded. Any type of patient information can be stolen, and that's not a good thing to have. A lot of fees and everything. How are visitors managed? Do you have to let them in the back by unlocking the door, or can they freely come and go? Do you have locked doors throughout the practice? Do you use biometrics? Video monitoring? How are laptops secured and used? Do staff members take them home, or are they left in the office? Do you have encrypted laptops? The next question that we hear a lot is, can I just fill out a checklist myself? Some of you may have a generic checklist that will answer some basic questions. While a checklist is a good start to a security risk assessment, it has many more parts that must be researched and documented, like we just talked about. Smaller practices may be able to conduct their own security risk assessment, but it would require the same knowledge and thoroughness that a professional would give to complete the SRA. A certified professional should be the one to conduct your risk analysis for your practice. They should have a professional program that scans all workstations and servers to verify the information. The program usually will search for common medical terms to see if you have any type of documentation saved on a computer. The next question is, I have a company complete an SRA for me. I'm done, right? Just completing your security risk assessment doesn't mean you're done. There must be a risk management plan created from your risk assessment, and you must start implementing fixes or a plan or solutions for those risks that were found. It should be conducted every single year, and your documents should be updated with the changes that you've made from the year prior. It's not something you can just do once and walk away. I have a hosted EMR, and I'm secure. No, your local computer can still have the potential to have patient information on it. Think about this. Have you ever visited any hospital websites or portals or insurance verification? If you have, then you could have cookies on your local computer which would contain patient information on. That needs to be removed, or if it's not, it needs to be monitored and secured. Next is my EHR is certified and provides me with SRA. Some EMRs and EHRs can provide a risk analysis for you, but it's only a small portion of the actual HIPAA risk analysis. It doesn't include anything outside of your EHR, like I just talked about, any portal websites, anything, or if office assistant saves any documentation from an email or anything like that. That's against the security policy. It needs to be reinforced with security. So overall, the main point of a risk assessment is for your patients. Personal information is valuable in the wrong hands, and any safeguard you can implement in your practice is a plus.
I think the most important thing is on the chart, it was very easy to keep it secure. Lock the office at the end of the day. When it comes to digital market, and it was shocking when I heard that some of the digital information in the black market goes as high as $500 per information. So the person who is stealing may not use it directly, but may sell it to third parties. So that's why it's very important that we keep it secure. Now, to add to the self-checklist report, like Marian said, when you upload your SRA, it's very important that it's well understandable. And when you do just a checklist, it's only a checklist. It does not have a detail. So it raises the other questions that, hey, now I need this document and that document. SRA nowadays, it's not that expensive. And if you get it done through a professional, they provide not only they provide the summary that they actually want to see, but it has all the supporting documents that goes with it. So it's less chance for audit later on.
So next we're going to talk about the most common issues. So I'm usually the one that's on site doing all the security risk assessments, so these are what I mostly see. The major one is unsupported operating systems. Windows XP is no longer supported by Microsoft, so without those critical security updates, your computer and network become susceptible to harmful viruses, spyware, and other malicious software. Next is Home Edition of Windows. This version does not contain built-in security to help protect your environment. You should not buy computers from local retail stores, so you should contact your IT vendor to purchase those PCs. Next, antivirus. Usually we see no antivirus or anti-spyware installed. Every computer that is on your network must be protected from viruses and malware. Or you could also have it installed but not updated. New viruses are created every day, and your antivirus must be up to date. If you have a store-bought router, that's another no-no. It must be a business-class router, and it should have the following: IPS, which is intrusion prevention system, and malware filtering. These are two modules or subscriptions that are typically available with any business class router, but cost extra to maintain and have updated. So you may have a business class router, but you may not have any of these modules, and that's something that you should definitely invest into.
And if I may add, Windows XP, we still see these days that Windows XPs are still around in some of the networks. Those are the target. People are looking for in the black market, they are looking for Windows XP machines because they know Microsoft is not going to do anything about it. If I find my way in the machine, I'm not going to be stopped, versus if you have Windows 7 or Windows 8, basically as soon as security is breached, either the operating system comes out with the patches for it or antivirus program comes out with the patches, whereas Windows XP, nothing is done. So if you have a Windows XP in your machine, you should get rid of it as soon as possible.
Yeah, because that's last year it was stopped support, and that's been a whole year that hackers have had a way to try to find an entry to those kind of machines with no updates. So part two, audit logging. Basically, audit logging is every time a user logs into a computer, it creates a log. It shows every single time, date, everything. It usually is in Windows and your EHR. A majority of breaches are caused by your own employees. Just recently, Florida Hospital had 2 employees copy medical records. I think that was in 2012. But having specific usernames and logs to track who is logging into each system can help you pinpoint when an issue occurs.
And it's let me add, when John is talking about the auditing all the logs, it's not only a EMR. EMR is, yes, that's everything is based in PHI, so definitely every single thing that is done within the EMR is audited by all the certified EMR companies. But like he was talking about that on the personal computers, you could have information of people going on, nowadays what we see very commonly is employees going on a lab companies to put the patient lab result, and then they print it to PDF to save it on their computer, so later on they can upload it to the EMR, but now they have that document in their system. Now they could just email it to themselves or put it on a web. So if you have some kind of security that logs the local computer, that's when you get to know that, yes, during this time, this was the person who was using it, and these are the things that they have done.
One of the next biggest are no password policies. This is probably the most dreaded part of a security assessment for anyone, because I know none of you want to change your password or have a hard time remembering passwords, but we have to do it. Using generic passwords, anyone with technical background could log into your computer. Setting a password policy includes password length, password complexity, and passwords never set to expire. So passwords should be changed at least every 90 days. It should be at least 8 characters long, and it should have some complexity like numbers, different symbols, so that way it's less susceptible to a brute force attack. And last but not least, automatic screen lock not turned on. Anytime you are away from your computer, your screen should be locked. I'll give you a little scenario. Say I go to the doctor's for a cold and they leave me alone in the exam room. The nurse inputs some information into their EHR and leaves on the screen and then leaves the room. And then let's face it, I'll have to wait 45 minutes before the doctor shows up. But if I'm a disgruntled or a dishonest person, all I have to do is go on the computer in the exam room, and any information that she has up, I can take a picture with my cell phone. It may just be my chart that's up, but if I'm the least bit tech savvy, I could do a quick search with a generic name and have a whole list of patients. So yes, you will have to re-enter your password every time your screen locks, but that can be a pain, but it's something you have to do. So with this, there's 7 different steps.
If I can add, sorry, before you move forward, I would like to add some things about the passwords. I know it's pain, like you mentioned, but there are many other tools that you can implement. Biometrics, that's one simple one. Or you can have some tag systems. So there are a lot of solutions that are out there that helps you be more secure without changing your passwords very frequently. But It's extremely important. I don't know if many of you guys calculate that how much time patient spends in your exam rooms. But from my personal experience, that I never had a doctor walking into the exam room within 10 minutes. And I can tell you, I'm not that technical, but any of my technicians here, if the password is simple on their computer, it takes them, we calculated, it takes them 3 minutes to reset your password or to get a hold of your passwords if they want to hack your computer. So having a simple password does not take long for somebody to get it. And once they have that, they can do anything with it because you are not changing your password that often. So changing password, but having very complex password is very, very important. Or look for another third-party tools that are out there.
So these are the steps that we take for the risk assessment. On-site visit, like I talked about before, there are many things to look at while on-site for security risk assessment. As there are no tool or program to verify and check the physical security in your practice. The external scan, this compiles a comprehensive report that evaluates any security holes and warnings to make better network security decisions. It scans a total of 65,000 ports. The network scan, it checks to see if disks are encrypted, if usernames are unique, audit logins, list of shared drives, and whether or not they contain possible PHI, security patches up to date, antivirus installed, pretty much everything that we just talked about in the last most common seen issues. The next step would be meeting with your security officer. It's to help answer a list of questions that can't be determined by the site walk or by the software scan. One of the major things are like copiers and printers in the office. Are they on lease or not? Most leasing companies will take care of this data, of the data on the copier, but if you own the copier printer, you must make sure that any hard drive that has all data removed from it, the physical drive, or destroyed by a certified company. In 2013, a practice discarded an old copier, and when they were audited, it led to a $1.2 million fine. So do you have guest wireless, the same network? Any guest wireless should be on a separate network, so that way no one can try to hack into your secure network or what you think might be secure. Is your EHR hosted or is it local? How do you send and receive faxes? Locally, electronically? Do you communicate through email? It should never be with a free service like Gmail, Yahoo, or Hotmail. There's no way to secure against patient information from being stolen from a free service. Next is generating reports. So once all the questions have been asked and pictures have been taken, a professional program will compile all information from what we discussed above and put them into reports and spreadsheets with all the data. Next is meeting to review all this information that was generated. You must review documentation to have a full understanding of all risks. And last but not least is your risk management plan. The management plan is in place to provide solutions for problems. You must follow up with an IT company to create a timeline to resolve these problems. And actually next month, our Lunch and Learn will revolve around just the risk management plan.
Thank you, John.
Next, we have Neno, who's our HIT consultant. He's going to discuss a little bit about our history and SRA.
Thank you, John. Hello, guys, and happy Friday. Only a couple more hours and it's the weekend, so hold on. I also want to thank you for taking the time out of your day to meet with us, and hopefully this webinar will give you enough information to run your practice more smoothly and seamlessly. I'm going to briefly talk to you about the history of the risk assessment and inform you about the timeline process. Computex City has been doing our risk SRA since 2012, which makes this our 4th year doing this in the business. And since we live in a time of a fast-evolving technology, a lot of regulations and rules change. Omnibus and HIPAA are the ones that enforce these rules. And Computex City has done everything to keep these regulations and all the rules in our desk, and we know what's going on. And we have done over 50 SRAs since we began in 2012, and a record-breaking 25 last year. And I really think that record is going to be broken this year because we're on the path of doing 30 already. Also, I'm going to be talking to you about the timeline process with SRA. One of the first two questions we get asked by our clients is, how long does it take to finish a risk assessment, and can we do it tomorrow? We definitely cannot do it in one day, but John, our specialist, has gone through so many that we can really get these done in a matter of 2 weeks. So if you guys are interested, if you have any questions, please contact us. We'll have all our information at the end of the seminar, and do not hesitate to ask us anything. And all these assessments also vary by size of your practice and how many locations you guys have. So like I said, if you guys have any questions, please do not hesitate to contact us at any time. And I'll move this back over to Soren again. Oh, Marianne.
Yeah, so let me wrap everything up for you guys. Basically, the plan for 2015, and that's the reason why we wanted to have this webinar, is to make sure you guys are prepared for this year and not waiting until December 31st to do your security risk assessment or not know what to do. So you have to act now. So first you have to prepare yourself, basically identify if you're even, if you're a covered entity, and that includes, business associates or like your vendors as well. And you would have to assign some sort of leadership in your practice. I always recommend you do monthly meetings to make sure you're compliant with meaningful use, and you have a set plan for security risk assessment, and you're actually working on any remediation plan that's in place. So always assign one person in your practice to make sure it's taken care of for you. So again, you don't have to wait until December and start panicking. Then you would have to do your risk analysis and plan for it. So basically, what do you need to do? How are you going to conduct the SRA? Who are you going to contact? And when is it going to be done? So make a plan from the beginning of the year or now, and then make sure you do like a progress update to make sure you're staying on track for the deadline. And then for meaningful use, you basically have to make sure you're compliant throughout the whole year. Don't just focus on your attestation period. I mean, this year it's probably 1 year for most people, but make sure you're compliant as you go, not just to obtain incentive payment. This all has a big purpose, which is improving the quality of the patient care. So make sure you're complying to everything for meaningful use. You're documenting everything as you go. When your reporting period changes to 1 year, you basically have to document everything that's done within that reporting period. So make sure all your screenshots are saved for all the core measures, menu sets, clinical quality measures, and your SRA. And then you have to register to do meaningful use for 2015 on using your PICOS login on CMS. Basically, you go on and register for year 2015. And then once all your data is gathered and the deadline approaches, you attest and submit and certify that everything you submitted is accurate to the best of your knowledge. So that's kind of where it ends at the attestation, and then you kind of cross your fingers and hope you don't get audited. But if everything you did right, if everything you, for meaningful use, you're compliant with, you don't have to worry to get audited. And actually, you're happy to get audited because you know you'll be passing and you're complying with all of the measures you're asked to do.
Perfect. Thank you, Marianne. So we are including our contact information if you guys have any question about this webinar, or if you have any questions regarding the SRA, either you can go on our website and fill out the forms. You can just go to Desk Consulting after CompuTechCity.com, fill out the form, and one of us will be in contact with you, or you can simply send us an email at sra@CompuTechCity.com. Again, either anything that we covered in this webinar, and if you have a question, of course you can ask right now, but later on if you come up with any question, just feel free to shoot us an email and one of us will get back to you. And like Nano said earlier, if you're interested in our service, or if you'd like to know more about it, how is it done, what are the things that are part of it, you can do the same thing, either contact Nano directly or send me email here, and one of us will get back to you on that. To go further, basically, I know in this 1 hour webinar we couldn't include everything, so the next lunch and learn that we are doing is the management plan that John talked about. And in the management plan webinar, we're going to cover the top 20 things that must be implemented to manage your risk and the solutions to manage your risk. What are the solutions you can implement, how, and the most important is how we can achieve all this by meeting your budget. Of course, everything has a budget to it. Unfortunately, we haven't picked the date yet, but of course it's going to be in the May, so just stay tuned for it, and we will be sending you email about it. So that being said, we are finishing our webinar, and we are open for any questions that you have. These are the specialists we have, so anything that we did not cover in webinar, still you can ask them, and they'll be more than happy to answer it. So we are right here waiting for you guys for any questions.
So the question that we received was, what is the best way to initiate the process of a quote? Like we said, we listed our contact information, or you can just send an email to sales@Computech City or to me directly, and basically we can set up a call between us, and we'll go through the whole process of the quote, price, and also how long it will take us to finish this, and we can also set up an appointment for John to come on site and do the whole walkthrough as well. So like I said, just shoot me an email, and I'll be responding as soon as possible. Anything else?
If you guys have any question, please, you can ask on the bottom left side. Just type your question and hit ask button, and it will pop up on our screen. Is there any other question?
So we have one question that actually came in, and it's asking how long does the on-site visit usually take? John, do you want to take this one?
Yeah, so typically for an on-site visit, it really depends on the size of the practice, how many locations you have. If you have, a small amount, 4 or 5 computers, it could be done in an hour, 2 hours tops. And that would be, to scan all the computers, meet with the security officer. Now, if you have multiple locations, of course, it's going to travel time and everything. But if you have a decent-sized practice, say around 20 computers, if it can be done centralized, where I can scan everything at once, then it's still maybe 2 to 3 hours. If I have to go around individually and scan each computer, then we're talking maybe more like 5 to 6 hours. So really, it boils down to the size of the practice, the location, and whether or not your practice has a domain or no domain at all.
It looks like there was one more question, and it asked, after the risk assessment is done, would you guys recommend everything that needs to be done and fixed to get us properly secured?
Right, so I'll answer that. So it's not only for us, but if you get the risk assessment done by any third-party company, at the end, what you guys should do right after that is have a meeting with your IT company or IT person, go over those and make a plan on how you are planning to implement it. One of the common ones was a password. And in many cases, we come across that, office managers on the board that they want to have a password policy, but the doctors are not on the board sometimes. So the IT person can actually create the better plan that we can meet the doctor's requirement as well as office manager and the staff requirement and roll it out little by little. So definitely have a meeting. Go over with your IT person. If we happen to be your IT company and you have got the risk assessment done through any third party, please contact your technician or your account manager and give us the copy of that risk assessment so we can analyze it and then get back to you on what are the things that we need to implement and how we can implement, and we can create some kind of timeline. So that being said, Nana just confirmed we don't have any more questions. But again, we're going to be going more into detail on the managing the plan and how to implement it in our next webinar. So please join us on the next webinar. And thank you very much for your giving us the time on Friday afternoon, and have a great weekend and see you next month.
Thank you, guys.
Thank you.